Hello, everyone. My name is Lucy, and welcome back to the One Spa Chicago podcast. Today, I have a really exciting guest. This is Dr. Courtney Murphy, a fertility specialist. So we're going to be talking about fertility, aesthetics, and just kind of taking that step to seek out expert care.
Thank you for having me. I'm so excited to be here in your beautiful space.
Thank you so much. I'm very excited. So I'll just let you give a little intro on you and what fertility is, what you do day to day, and just kind of a glimpse into your world.
Yeah, absolutely. So as Lucy mentioned, I'm a fertility specialist, and I think fertility care encompasses a lot more than people understand or expect. I think when people hear fertility care, IVF is what comes to mind, right? In vitro fertilization. But the reality is that we do so much more than that. So we see individuals and couples, patients undergoing cancer therapy, patients from the LGBTQ plus community, and really get an understanding of what their goals are when it comes to family building and how we can best support them to get there. And we do a workup from the beginning to the end, and we do whatever we can to help patients along that journey.
Yeah, that's amazing. I think that's a common thread in a lot of, concierge style clinics and what we see a lot too. So I'm excited to talk a little bit more about that. So you touched on a lot of different types of people who may come to a fertility clinic. A lot of times we probably assume it's just a mom or a dad seeking advice on how to start their family. But I guess if you want to go into a little bit more detail about why someone may come to a fertility clinic.
Yeah, absolutely. I think the biggest step is understanding when is the right time to seek care. And the reality is that we have, again, a variety of different reasons. But if you are a couple who's been trying to conceive and you're under the age of 35, we generally say try for about a year. At that 12-year mark, if we've been unsuccessful, come see us. Or if you're over 35, we shorten that timeline to 6 months, and we can talk about why that age-related change matters. So we say come see us sooner. That being said, there are red flags for general fertility purposes that we say maybe don't wait the 12 months or don't wait the 6 months. And those are things like if you know you have irregular periods and they're not like clockwork for you, or maybe you have really painful periods, maybe you have known fibroids. So there's definitely different things in someone's history that might prompt care sooner, even in patients with recurrent losses, or say, I'm in my early 30s. I know I'm not ready to start building my family yet, but that's really, really important to me. And coming to us doesn't necessarily subscribe you to doing treatment or mean you have to. Similar to you come in for a consultation, right? You come in to get information, learn about your bodies, and learn about what makes sense for you, and then you go from there.
Yeah. No, that's a great point. And I think I would categorize myself in that exactly what you're talking about. I'm 30. I definitely want to have kids, but I'm not quite there. So I've been really looking forward to this conversation too. And I guess that kind of leads me into what is the right age to start looking into this?
So when to start treatment is generally in the early 30s, I would say, especially if you're in a situation where you're not ready to have children yet. Maybe you're partnered, maybe you're not, but we know building a family is something that's important to you. And in the early 30s is really that prime time where you still have the optimal egg quality, right? When we think about the ovaries and the eggs, that's really the driver, for the most part, of what can lead to a successful pregnancy and a healthy live birth. And our age is really one of the biggest drivers of our egg quality. And we can touch on things like lifestyle elements, but really there's no test aside from age that tells us about the quality of those eggs. So when we think about optimizing our youth, and we talk about preserving beauty, preserving fertility, early 30s is really the ripe time. That doesn't mean that you can't if you're in your mid to late 30s. We generally talk about an offer egg freezing up to age 38 and beyond that for certain circumstances. But early 30s is the right time to talk to your doctor about it, right? Book a consult or at least talk to your OBGYN to get some information and then go from there.
So I definitely think in my just glimpse of this whole topic, generationally, we see that people have children later, and that doesn't necessarily mean that you're not optimizing that potential family building stage. Do you, in your time as a fertility specialist, have you seen a shift in that, or have you just kind of picked up where we are in time and space right now?
No, trends are absolutely changing, and they have. If you look over the last 10, 20 years, just as you mentioned, we're waiting a little bit longer to start our family, right? Women are in the workplace, we're spending time on our education, developing businesses, and I mean, that's amazing, right? That's a huge part of our life and our satisfaction. But at the same time, we're maybe not meeting people the same way that we used to be. There was actually an interesting article that came out recently that correlated this delay in childbearing to the increased housing costs. It is so expensive to live. So people are staying at home a little bit longer. It's a little harder to date when you're at mom and dad's house. Not impossible, of course, but I think regardless, we're waiting longer. We know the longer we wait, again, it's that change in egg quality that really, really drives fertility and pregnancy outcomes forward. It's not the whole picture, but it's a big part of it.
Yeah, the more you know. I think it's really just this big guessing game for a lot of people who haven't taken that step yet because, you know, like me, they may not think I'm not ready to have a kid yet, but that's why it's so cool to have this conversation.
Yeah, and bouncing off of that, it shouldn't be a guessing game, right? Know your cycles, know your body, right? We do so much research about what can we do for diet, exercise, etc. Your menstrual cycle is like a vital sign of your reproductive health system. So know that. And I laugh with people. Not everybody gets to have an OBGYN girlfriend in their group chat, right? So find someone that you can talk to and connect to and ask questions because knowing about your body is so important.
No, I think that's really important. And I will say there are so many really cool tools just as someone who, you know, has had my period for the last 19 years. And I have changed so much in just how I treat myself, you know, understanding even like my luteal phase when I'm follicular and all these things have played such a big part into how I give myself more grace. I prioritize comfort and things, and my Aura ring has actually been really, really cool, and just understanding that more, and it's like clockwork now, which is really, really cool. And so I feel more in tune with just myself, which I think is, you know, nice to have a glimpse into that.
I got the chills when you said luteal phase and ovulation because just knowing what those are, right? They're continuously happening in our body, but so many people don't know. But at the same time, it's amazing that technology is kind of catching up with us, right? We have the Aura ring. There's so many other things that people that can use for menstrual cycle tracking now to better understand your body. And that's a lot of part of the reasons why people come see us, right? Even if you haven't met that 12-year mark or whatever, you can come and get the information, right? Who's better to learn it than from a doctor than somebody who may give unsolicited advice on menstrual cycles. So.
Totally agree. So I do want to talk a little bit about fertility testing. I know that there's probably many, many avenues you could go, but if you're someone like me who wants this in the near future but isn't quite ready, or someone who is actively trying to conceive?
Yeah, that's a great question, and we see this on the daily. So for my individuals or couples who are thinking about trying to conceive, but again, not really in the next year or two, but maybe down the line, there's a few different ways that we can take this. One is a counseling on age, right? That's important. It's not a test that we can do, but it's a definitive number that we know of, and we don't control the clock. It goes ahead without us. So we talk about that, but also there's ovarian reserve testing. So we talked about quality, right, being tied to age, but there's a question of quantity. Well, how many eggs do we have left in the bank? And one really cool fact, and I think a lot of people know this, but women are born with the amount of eggs that they have throughout their whole reproductive life.
Freaked out when I learned that.
Okay, a little step freakier, we actually have the most when we're 20 weeks gestation. So still a fetus, we have 6 to 7 million eggs. And by the time we're born, we're down to 1 to 2 million eggs. And we actually only ever ovulate 300 to 500 in our lifetime. So we lose so many in a gradual process, but I do want to emphasize that it's a curve, right? It's not a cliff. You don't fall off a cliff the day you turn 35. It's a very gradual curve, but there are certain markers that we can test for to get an assessment of what someone's ovarian reserve is. And that doesn't give us a number of how many eggs you have left, but it gives us a relative. Are you normal for someone your age and having a normal amount of reserve, a little bit lower, a little bit higher? But something that's important, and I tell all my patients, is understanding the context of that, meaning that this number doesn't predict your ability to conceive or not. It gives us an idea of if we were to do egg freezing or we were to do treatments like IVF, how would you respond? So it's all a bit of a gauge. That being said, if somebody has a really low reserve, they might be like, oh, I need to do this sooner rather than later. So it's used as a counseling tool as well to give a prediction for how many eggs we think we might get if we were to do a cycle.
Like a benchmark kind of.
Yeah, exactly. And then other things to talk about to your fertility doctor if you're not ready to start trying it but want to in the future. If you are partnered, is genetic carrier screening. Again, and not a test that predicts your ability to conceive, but a test that tells you about the potential genetic risk to a child. We don't have to go into the nitty-gritty, but it's essentially, do you carry diseases that you don't know about because you have another normal copy of the gene? Well, 1% to 2% of the time we find that partners are overlapping. And if you're overlapping with your partner for the same condition, well, then we might want to talk about doing IVF with testing embryos to make sure they're not affected by that condition. And examples of things are like cystic fibrosis or spinal muscular atrophy. So those are things that you can get information on ahead of time. Right. Again, not really predicting your ability to conceive or not, but just giving you information about future potential pregnancies. And then another thing to think about is, do we have sperm?
Yeah.
Right. So one of my providers loves to call it a prenup in a cup, which I think is hilarious, right? We date all of our partner because we like how they look, their education, their mannerisms, but do we want kids? Because sperm's important for that. So that's another thing you can consider doing. But for those who are in the throes of it, they've been trying to conceive, it's been a year, what do we do next? Well, we do the ovarian reserve testing. We recommend genetic carrier screening, but we also need to look at the uterus and the fallopian tubes to make sure all those parts come together. But we really do look at the whole person. We look at lifestyle, we look at their medications, their medical surgical history, just as you guys would, in addition to checking other hormonal parameters that can then affect fertility, like thyroid, prolactin. So lots of details, but if you talk to your fertility doctor, they'll go through all of it in detail, and you should always be in the know of what tests are being done and why.
Yeah, I think that's super important, and something that I love about modern medicine, if you will, is that there really is an emphasis on looking at you head to toe, you know? I think a lot of people like aesthetics too, they assume we just treat the skin on your face. It's like, no, we treat head to toe, externally, yes, but we have to look internally to really understand why things on the outside are happening. So something else that you touched on that I've read a lot about online and have been curious to ask you a little bit more in detail, what is the importance of the health of the male and his sperm when you are ready to conceive, and how does that play kind of a big role?
I mean, it's critical, right? We know that when we look at all causes of infertility, a third of the time it's solely a male factor, meaning impairments in semen parameters. And then another third of the time it's actually overlapping female and male. So up to 50% of infertility cases are secondary to male factor. So it's absolutely present. And the easiest way to test is with a semen analysis. And we always say if a patient has an abnormal, we repeat it a week later. But there are lots of different environmental things or even daily lifestyle things that can contribute to that. So marijuana use, tobacco use. So those are like the whole picture lifestyle things that we try to optimize. And there's lots of different things that we look at sperm. How much is there? How much is moving? How much looks normal under a microscope? Another little fun fact, I mean, men produce millions of sperm, and it's produced every 90 days is kind of the life cycle that it takes. And when we look at it under a microscope, we look for how many look normal. It's called the morphology. And we actually only expect 4% to look normal. So we're not asking the world for that. But still, so we see abnormalities in that. And depending on what the degree of abnormality is, we'll determine how we can use that sperm to obtain a pregnancy. But there are really important things that I want to make sure every single male and female with potentially a male partner out there is listening. Do not take testosterone if you are trying to conceive. There are a lot of men's health clinics out there, and a lot of men even seeking treatment for hair loss. And some of the oral medications for hair loss and testosterone can completely wipe out a sperm count, or at least have negative impact on it. So talk to your doctor if you are trying to conceive before starting any sort of supplement like testosterone or other treatment for hair loss to make sure it won't interfere.
That's really interesting, actually. I have somebody I knew who went through this. They supposedly had a very low sperm count and were advised to start testosterone. This family was not even ready to start conceiving. This was like, couple years into the future. And so I don't really know what to say to that, but I'm sure that happens a lot.
Tell them to stop. That's what you say.
Good to know.
But I mean, as soon as your body starts taking testosterone, normally men who produce it, their body was like, oh, well, I'm getting it externally. I don't need to make my own. So the testicles completely shut down.
Wow. Well, I mean, leading into that, I'm sure that there's so many factors to consider if we're looking at IVF, or we need egg donors, sperm donors, these pools of people you were touching on. We want our partner to be attractive. We want our partner to have a great education and all of these specific types of characteristics. But, I'm sure people go to their fertility doctors and think, well, I need a sperm donor and I want him to be an artist and a mathematician and a scientist and an astronaut. So what does that look like?
You'll find them. You'll find them out there. The sperm banks are pretty robust in different types of bankers that are there. And there's lots of different ones throughout the country that people, I always tell my same-sex female couples, have a glass of wine, have a little date night, and just scroll.
Yeah.
Scroll the sperm banks, right? You get to date someone sort of kind of who you want to be contributing to this pregnancy. So from a sperm donor perspective, there's actually quite a variety, and you can get all that information, like what their hair color is, their eye color, how tall are they, how athletic were they, whatever attributes you're looking for. You also do get genetic information that's important to know, and there's other nuances that from a medical perspective are important to know when picking a sperm donor. But I think maybe a bigger challenge sometimes is egg donors and making sure that our egg donor reflects sometimes the ethnic background or the racial background of the couple that's seeking egg donor. There's a variety of different reasons people may seek donors, but we know that there are less minority representation in certain egg banks, and those come harder to find. So talk to your fertility clinic as well, because most fertility clinics, if not all, have a third-party reproduction team that helps patients navigate that space. It's really, really hard.
Yeah, I can imagine. So what are some earlier proactive steps that people can take to preserve their fertility? We're talking about preservation today. What do you tell your patients, maybe someone like me who is ready for this but not right now?
Yeah, I think if you're coupled, talk to your partner, right? What do you guys want to see for your future together? Do we want 1 child, 2 children, 3 children, or more? Because that can really drive timing of trying to conceive, but also preparing, maybe not for baby 1, but maybe for baby 2 or 3 if we're going to be in our later 30s. And if we're not in that position and we're single, unpartnered in our early 30s, ask your OBGYN, and if they're not giving you answers, just go seek a fertility care. Go see a doctor, have the conversation, and you can at least get information, right? Knowledge is power. Going into that consult doesn't commit you to doing any sort of treatment per se, but you at least have the opportunity to learn about the information and what's available to you. Egg freezing is kind of what we think of when we hear about fertility preservation for women. And we've come so far in our ability to freeze eggs and what that means for potential outcomes. And for everyone, it looks different, right? Depending on the age you freeze, how many eggs you have can kind of predict your ability to have 1 or maybe more live births in the future.
Yeah.
But another important note is that just by freezing your eggs, you kind of have them as a reserve, right? They're available to you at a later point if you need. Doesn't always mean you need to come back and use them, but they're there as a safety net. So another important thing for women who are maybe changing jobs, joining the workforce, ask your employer. Ask your employer what their benefits are. We are currently in Illinois, which is actually a mandated state, meaning that every large employer is required to have some sort of fertility benefit if their headquarters are in Illinois.
Yeah.
So you're in a place of advantage from that perspective. So know what your benefits are and just ask questions.
Yeah. Knowledge is power, as you said.
Knowledge is power.
So you touched on egg freezing. I'm not totally privy to that process, but, say I wanted to start. How long does it take?
It actually only takes 2 weeks. It's a really short period of time, and we're giving injection hormones that your brain normally produces, but in much higher volumes to get multiple eggs to grow. And then there's a surgical procedure. That's a minor surgical procedure. You're asleep and comfortable, but breathing on your own, and we retrieve those eggs and then freeze them later that day and let you know how many eggs you were frozen. So 1 cycle takes about 2 weeks, and depending on everyone, it might take more than 1 cycle to have enough eggs in the bank that you feel comfortable with.
What is the amount of eggs that you're looking for? Is that kind of case by case?
Yeah, it's highly individualized based on age, but I generally tell 35-year-olds, 10 eggs in the bank gives you a 70% chance of 1 live birth. So you can kind of gauge it based on reserve as well. Yeah.
Okay. And I'm curious too. I feel like, we hear this all the time and we see this in movies when people are trying to conceive. The more that they try, it seems to be harder and nothing's happening. And then all of a sudden, when you're just happy and carefree and stress-free, there's the baby. So how does these environmental stressors and just, we're living in a really interesting time. There's so much access to information and heightened stress and so many things going on. Like, where do you start there?
Yeah, I think it's really, really important in making sure that our couples and individuals know that stress per se doesn't cause infertility, right? I think what's really hard for people that are going through this time of trying to conceive, because a common perception is stop caring, stop thinking about it, it'll just happen.
Right.
That's really, really hard for patients to hear, because the reality is, again, stress doesn't cause infertility, but the opposite is true. Infertility causes stress, right? It's stressful at an emotional level, right? We think like, I'm a woman, my body is made to do this. I'm told my whole life, if you have sex, you'll get pregnant, and now I'm trying. It's the thing I want the most, and it's not happening. So there becomes a lot of self-doubt. There can be question in relationships. It becomes really taxing when you're having sex for a baby and not sex for fun, right? It takes the joy out of it a lot of the time. So I think putting less pressure on the couple and individual as like, take a vacation, it'll happen, because that's not the reality all the time, right? But it's seeking the information and getting the care so we can, from a scientific perspective, evaluate, is there something that's going on that's overcomable with maybe oral medication or a little bit more monitoring with an ultrasound, and then we can help guide the process depending on the workup from there.
Yeah, that makes a lot of sense. I think that it's important to, like you said, knowledge is power, but it's important to just take that step of getting the information and understanding where you are in space and time, and then making an informed decision from there.
Absolutely. All of our jobs is to provide the information, like you, right? You do an assessment of like, what are your goals? How do I assess you? And what do I recommend as next steps? And it's up to the patient, client, your perspective, how they do those next steps.
Right.
Where they go.
So, a couple last questions. I wanted to ask, I guess, what are some trends or technologies in your field right now that are really exciting, or some advancements that may be coming that you are looking forward to?
There's a lot of changes in the world of reproductive science and medicine, and we've come so far over the course of the last several decades, but even in the last 10, 20 years when it comes to genetic testing of embryos. And we've gotten so much better at it, and our technology continues to evolve to help give patients and couples information about their genetic risk to the pregnancy, and helping to optimize and select embryos that are at the highest chance of a live birth, right? Because that's the goal at the end of the day, is a healthy baby. So we've come so far in that regard. Even as it comes to egg freezing, we've completely changed the way that we've frozen eggs. And we're so much better at it now. It's a single cell. We're asking a lot from this single cell to be frozen, thaw, and survive that thaw. And we've come an incredible way. And just knowing how much the field has changed, even in the last 20, 30 years on its own, I can't even imagine what this field is going to look like in another 20, 30 years from now. So it's exciting.
Yeah, very exciting. So my final question, if you could debunk one fertility myth, what would it be and why?
It would be that IVF is the only option, because it's really not. When we think about fertility care, it's really like a step stool. I always approach it like a ladder, right? We start at the easiest, least invasive, reachable treatment first, and then we make our way up. And for some people, it's the right answer. If we don't have fallopian tubes, we kind of need to do that. But that's not the case every single time. So doing the investigation work is my job, and then we offer treatment based on that. So IVF isn't always the immediate option. So I think it's important for people to know that, because I think it's part of the fear in coming in to see us.
Yeah, I definitely think that, before speaking with you, it was easy to just assume, all fertility clinics do is IVF and maybe telling you how many eggs you have, but there really is such a spectrum of how it's individualized and truly catered to the patient and the family.
Yeah, it really is, right? Again, our job is to provide the information and the best next steps for someone and help them get to that family that they dreamed of. Yeah,
that's very, very cool. So in aesthetics, as I was mentioning before, we definitely like to holistically treat people if, from the outside, it's not an easy fix with a laser, a little Botox filler, whatever the case may be. We see definitely a lot of acne. In my previous episode, I talked on gut health and, hormones come into the conversation. There's a million things it could be, but, we are now more than ever seeing a lot of PCOS patients come in and they have a little extra hair, hormonal acne, all of these things. Is PCOS something that you touch on, and what do you notice most with maybe externally and something aesthetically treatable that is an effect of PCOS that, may be a little more difficult to treat with just whatever the treatment plan may be?
Yeah, absolutely. We see PCOS a tremendous amount, right? It's the number one cause of menstrual irregularities in reproductive age women. So incredibly prevalent in our fertility population. But you raise a good point. I really do think talking about the whole person is important, right? And while my job as a fertility doctor is to help them conceive, I can't be ignoring the other things that are really bothersome to their lifestyle. And identifying that acne or that hair growth is part of actually the diagnostic picture of PCOS. So it's one of the criteria for being diagnosed with the syndrome. And there are certain treatments for acne that people can take, but they can't actually take it during pregnancy, right? Sometimes we recommend birth control pills, spironolactone, again, things that people can't be on during pregnancy, but we can maybe refer them to you for certain skin treatments that are safer and okay during pregnancy. Similarly, hair growth, there's actually not great treatment for active hair growth and hair that's currently there. There's treatment for maybe slowing future hair growth, but to remove what's there, that's where you would come into play and help with laser treatments. It's actually the only definitive therapy for additional hair growth.
Yeah. Wow, that's really interesting. You know, I think that it's a part of our world, but what types of things do you notice externally in a patient that, like you said, may not be treatable for you? You know, we talk about acne and hair growth. Are there any other telltale signs of, you know, if we're not seeing results from something, what would indicate PCOS externally? Yeah,
so it's a good question. And generally, the ability of the hair growth or the acne to be treated by you wouldn't necessarily signal to me that it's like PCOS because it's not going away per se, but there are generally other signs on the skin that can be insightful as to somebody's health history. For example, acanthosis nigrans, so darkening of the skin along areas like the neck, the armpit area, the groin. So those are things that
lymph node areas.
Yeah, or like even skin tags, so multiple skin tags. All of those things come together to actually be suggestive of insulin resistance. So it's knowing your body and being like, hey, this wasn't here before. Oh, these dark lines weren't here before. Talk to your doctor about it, right? Know your body. Are your cycles irregular? Is this looking like a picture of something that wasn't there before, maybe PCOS? So just talk to somebody about it. And your esthetician may be that first person you talk to about it.
Yeah, honestly, we play such a big role into the intersection of health and beauty here. And so I think with the rise in aesthetic clinics, probably fertility clinics too, there's so much misinformation. And so I think the most important thing, like you're saying, is to seek out that knowledge and really find somebody you trust and that you can build that rapport with, because the more that you try to seek out things on your own, I feel like you're just going to veer off the path and really not target what you're trying to treat or fix.
Yeah, and I just remember like everyone trained to be able to provide the highest level of care, right? And we don't expect you to be able to figure it out on your own. It's a big, scary world out there. So instead of trying to navigate and fight the misinformation that's online or putting your story together on your own, just come see someone who can help you do that. Because at the end of the day, we're all on the same team and we all have a shared goal.
Yeah. Well, this was really amazing to talk today. Thank you so much, Dr. Courtney. And I would love to know, just as we wrap up, tell me a little bit about where you work and how we can find you.
Yeah, absolutely. Well, thank you for having me. Again, my name's Dr. Courtney Murphy, and I'm a fertility specialist at Pinnacle Fertility, Illinois. That is here in Chicago. Our main office is downtown, but we have lots of peripheral offices in the suburban areas of Illinois as well.
Thank you so much for tuning in to this episode on fertility health today, and we can't wait to talk to some more exciting people in the industry, outside of the industry, and we'll look forward to that for next time. Thanks. Bye.
Bye. So fun.